Do you suffer from low back pain? If so, you're in the right place because today we are discussing two therapeutic options for you: massage versus physical therapy. Now, I do not believe that you need to learn to live with pain, which is why I started this channel, so that I can give you the information you need to find the pain relief you desire without pharmaceuticals. Now, if that is you, if you are the person currently who is popping pills every day in order to just make it through the day, then I want to give you a gift: my 30-day pain-free jumpstart guide. It's totally free. It's an easy to follow step-by-step guide to help you ease your own pain at home so that ultimately you don't have to rely on pharmaceuticals one day. I've left the link down below. Now let's get into the content. Welcome to Dialectic Healing, where we discuss a fusion of physical and mental therapies so that you can obtain and maintain your healthiest self. So if you have low back pain, you know the area in which you're feeling pain. However, a better question to ask yourself is, where is my pain coming from? It can either be coming from muscle tightness, or it can be coming from muscle weakness. There are even muscles down in your calf that actually refer pain all the way up into your low back. Referral pain is very interesting because it's hard to decipher where that pain is coming from. But that's where understanding muscle tightness really comes into play. Our bodies are full of nothing but pulleys and levers. You've got antagonist muscles and agonist muscles, all trying to work together in order to give you fluid movement, no matter what you're trying to do, whether it be leaning over to grab a pen, or taking a walk, or actually doing a workout. Any of these things could be triggering based on where that muscle tension is coming from. Now, this is where massage therapy comes in. If it is a matter of muscle tightness, if it's coming from your calf, or it's coming from your hips, or it's right in your low back, or it's all of those spinal erectors along your spine, or just your QL, if you're experiencing pain in your SI joint, or it's referring all the way down into your hips, then this is where I would suggest seeing a massage therapist, because that muscle tightness, that is what they excel at. A massage therapist can really get in there and ease that tension, increase that circulation, and alleviate any kind of inflammation that your body has brought in to try and heal the area. Alleviating those trigger points, that referral pain, and giving you more flexibility and more mobility in the way that you move by releasing that muscle tension. Now, if your pain is actually coming from a muscle weakness, then that's where a PT would be more effective in treating your low back pain, because what they're going to do is give you isolated exercises that's going to strengthen your core, which allows those muscles surrounding that low back to really become more stable. And they'll also give you stretches so that you maintain your flexibility, because that's very important when you're trying to move. So you need that mobility and flexibility at the same time. But the exercises that they are going to give you are really going to address the muscle weakness that is causing your low back pain. Not only that, they're going to work on proper posture and muscle activation. If you have one muscle that might be super strong, but another muscle that's a little weak, then work on the weakness in that muscle, easing the tension off of the stronger muscle so that they're not fighting each other and you have more fluid movement when you need it. I want to talk about the difference between sciatic pain and piriformis syndrome. Now, sciatic pain is definitely an impingement on the nerve. It's coming from the lumbar vertebrae. Somewhere along the way, your muscles are too tight, they might be out of alignment, and there is a pinching happening somewhere in the lumbar spine, pinching off that sciatic nerve, and you're getting radiating pain down your leg. Maybe it stops in your glute, maybe it goes all the way down your foot. Either way, you're experiencing sciatica. On the flip side, piriformis syndrome is more of a muscle tightness issue because your sciatic nerve actually runs right in between your hip rotators, which you have several, but the piriformis is one of the largest muscles. And when it's tight, it can pinch off that nerve very easily, in fact, and you'll still experience a very similar pain to sciatica. So I think these two might get misdiagnosed because they have very similar symptoms of that nerve pain running all the way down the leg. Now, if you're experiencing either of these symptoms, honestly, massage or physical therapy is going to help you. Number one, we're talking about easing tension. With exercise, stretching, massage therapy is going to ease that muscle tension along the lumbar vertebrae, ease the tension in your glute, and therefore your nerve can relax and not be impinged. Either way, we're looking at releasing tension off of that nerve. And both therapies are very effective at doing so. Now, as far as preventative measures go, I do always recommend someone to get a massage at least once a month, just for maintenance, especially if you're a super active person, if you're someone that has a very rigorous job, or even if you're someone that sits a lot for your job, if you sit at a desk regularly. Easing that muscle tension in your hips and your low back are really going to be helpful. So maintaining a monthly massage can really help ease that pain and prevent future flare-ups of where you're just sore daily and needing to take pain pills, right? Physical therapy can also be extremely important when it comes to prevention because the stretches and exercises that they're giving you aren't just for when you see them. They're for the long haul. The idea is that if you had a weak muscle, you want to get it strong and keep it strong. So you want to maintain those exercises, maintain the stretches that they're giving you so that you can continue to prevent the pain from coming back and keep your body strong and flexible and mobile. I hope that this information was helpful for you. And if you struggle with back pain and have dabbled in massage and physical therapy and found success or had difficulties with finding relief in your pain, leave me a comment in the notes. I'd love to hear about it, and let's just open discussion because this is really a common problem for a lot of people, and I really want to dive into this a little bit more in future content. In the meantime, may your pain be relieved.